The Los Angeles Reentry Collaborative's latest convening featured California's first Latina Surgeon General, Dr. Diana Ramos. She joined the collaborative for a talk that left the community feeling hopeful and inspired. Speaking about adverse childhood experiences, she brought up her own childhood, one of humble beginnings that started in South Central Los Angeles. She found herself surrounded by neighbors often in trouble with the law, and spoke of the indelible and traumatizing image of seeing a dead body outside her building one morning. The first in her family to go to college, she worked her way out of that environment by focusing on her schooling. These days, she makes the mental health of Californians one of her top priorities and insists on creating community among those who need it most.
We're born into communities, we're born into a family, and the hope is that whether that family changes from birth and it progresses and just really transforms as we get older, we have some type of community available to us. And really, that community could be after you get out of the prison system or the jail system. It could be some of the organizations that you help bring together and provide the support, provide the housing, provide the medical care, mental health care that everyone is so critically in need of.
Dr. Ramos was able to break the cycle, and she now inspires others to do the same. Adverse childhood experiences, or ACEs, are linked to poor mental health and poor social outcomes like arrest and incarceration. The more adverse experiences in childhood, the more likely a person is to have contact with the justice system. A key to overcoming the impact of ACEs is having a healthy community to belong to and caring friends you can call upon in times of need. She described the Los Angeles Reentry Collaborative as one of those key resources, uniquely weaving together formerly incarcerated individuals dealing with the challenges of reentering society with organizations directly committed to remedying this public health crisis.
I think this reentry community is amazing to be able to bring people who really are going through the whole system, the reentry system, to be able to bring in organizations, to be able to bring in those who are providing the peer support is fantastic. And this, I think, is a combination and the formula that you need for success. So thank you for all the work that you're doing.
In addition to hearing from Dr. Ramos, attendees of this convening got to take part in a Q&A panel around direct challenges related to reentry, along with breakout groups offering intimate counsel circles for sharing authentically and listening to the heartfelt stories and experiences of others. The Office of the California Surgeon General launched a $24 million public awareness campaign on ACEs and toxic stress. California is leading the way in addressing this public health crisis. Together, we can lead a national movement. To support this work directly, go to beyondusandthem.org/donate.